heart disease is the pill that we're talking about. And so you want to have a real reality check. If you're talking about heart disease, it all begins with arterial damage. And that usually begins in the teens and early adulthood.
Wow. So it goes that far back.
It goes that far back. So it's not the fact that heart disease doesn't happen overnight. You turn 40. Like I had two of my best friend's two brothers passed away from heart attacks in their 40s.
Late 30s, early 40s.
Yeah, and that's not just because it happened overnight. It gradually happened, and it's, yeah.
Everybody wants to eat like they're still 14 years old, 15 years old, and they carry that into adulthood, eating like that.
The problem is because you're eating like you're 14 or 15 years old all the way through. Yeah.
If that disease is starting early in teen years, oh my gosh, that's not good if your body.
Well, and that's exactly it. And as things go on, a lot of times the early warning signs are missed. Yeah. Even in mid-adulthood, like with women, you know how you go through menopause? Some women have it really, really bad. Some have it a little bit lighter. Well, they have found through studies that severe hot flashes are correlated with the arterial damage. So the damage inside your blood vessels. So the thicker the blood vessel, due to all the damage over time, like 3 or 4 times more hot flashes, more severe than someone who has a healthy, healthy arteries.
Oh, wow. I've heard that they're saying if you have severe hot flashes, like once you pass 60, it's like basically you have dementia at that point.
Interesting. So we're talking about this medication to help prevent heart disease. Is it dementia coming from the years of this drug?
That's what
the great question.
That's a good question to dissect.
A very good question. I like that question. Man, that's a great question. I got to look into that one. Man, so that's women. But you know what, men? Mm-hmm. With men,
okay, what is that? What is
the canary in the coal mine?
Which is
they can't get it up. That's signs of some serious heart disease, cardiovascular symptoms.
Okay, erectile dysfunction for those of you who are not catching on to what he's saying.
Yeah, ED. yeah. But again, that ED didn't happen just overnight. You know, it happened with damage progressing over decades,
right?
Over and over and over.
That's a problem.
Yes, that's a problem.
Right.
And so when you do get your labs back or blood work, like, oh my gosh, this is high, this marker is high. Our approach is to tackle it with medication versus addressing the root cause.
Right, because you'll still end up having that problem because you're not addressing it.
Yeah. And so here's the deal. I mean, the medication millions are taking that causes these devastating health consequences, they're rarely disclosed to patients. Here's some side effects of this pill, okay? This is crazy. So for the physical damage, there's like 19% increased risk of muscle or skeletal issues, of muscle or bone issues, injuries.
Oh, wow. So people say, oh, you have osteoporosis or something.
Well, not so much osteoporosis, but it's like you could sprain an ankle, you could twist a knee, you could have...
that type.
Yeah. Or you could, 30% chance of dislocations, strains. Wow. So it weakens your soft tendons, your muscles, your ligaments, and so you're more prone to injury. Yeah.
I know some people who've had some injuries and required surgery in the last few months.
And more than likely,
they're pretty young.
You have 50% chance of knowing that person is taking this drug.
Even if they're young?
Wow, 1 in 50 over 40. What's considered young? But 1 in 50?
In the late 20s, early 30s?
Could be. I mean, could be. Who knows how quickly they put them on this drug now.
Wow.
But